Dr. Sandeep Jha. I'm a liver disease specialist and a liver transplant surgeon, and I work as a consultant at Manipal Hospital, which is in Dwarka, Delhi, India. Today we are going to talk about upper GI bleeding or vomiting of blood that is frequently seen in patients with cirrhosis. Now, this complication happens because there's increased pressure in the intestinal circulation or your gut circulation due to cirrhosis of liver. The liver becomes hard and blood doesn't flow through it, and the proximal veins or the veins prior to that, they swell up with a lot of blood, and there's a lot of pressure in these veins, and eventually these veins cannot stand this high pressure and they rupture. And the most frequent site of rupture is in your food pipe, where once they rupture, you immediately lose a lot of blood, and that blood can come out as vomiting as a symptom. And this is one of the most frequent symptoms of decompensation of cirrhosis. So upper GI bleeding or bloody vomitus is one of the most frequent complications of decompensated cirrhosis, and it is also a marker that patient should actively think about getting a liver transplant done. Now, this complication is known as upper GI bleeding or hemetemesis in scientific term, and every episode of hemetemesis, there is immediate loss of around 1 to 2 liters of blood from those thin-walled veins, and suddenly the blood pressure of the patient drops and he goes into shock. And this condition is associated with nearly 20% mortality within the next 6 months. That means every 1 in 5 patients will succumb to these complications, and the family becomes very panicky. There's a lot of stress. The patient is shifted to the hospital in an emergency situation. He might require blood transfusion, he might require endoscopy, and he might require ICU based monitoring on an emergency basis to tide over this crisis. So like I said, every episode of hemetemesis or upper GI bleeding in a patient with cirrhosis is associated with nearly 20% risk of mortality. And if following that the patient gets treatment and is on treatment, then the risk of rebleeding is 30%. However, if the patient doesn't get treatment and doesn't stay in follow-up, then the risk of mortality is nearly 60% within the next 6 months. So it is very important to schedule an endoscopy and get an endoscopy done to get the status of your esophageal varices, and if they have to be treated, they can be treated in an effective and elective manner by doing a banding procedure or ligation procedure, where these dilated and tortuous veins are taken care of, so that the risk of hemetemesis or upper GI bleeding and life-threatening situation is prevented. Eventually, close to 40 to 60% of patients with cirrhosis will have esophageal varices, and nearly 30% of the patients will develop esophageal varices within 3 years of diagnosis of cirrhosis. So, if you have this hemetemesis or upper GI bleeding then due to cirrhosis, then you should immediately rush to a hospital where you should be admitted, and the facility or the hospital should have the facility of at least endoscopy services and emergency blood bank services and also ICU based care, so that this life-threatening complication can be taken care of. Now, in an emergency situation, the therapy that is recommended in such patients is immediate start of antibiotics in these patients, which has been shown to decrease the mortality in such a situation. Immediate starting of vasopressor therapy like terlipressin, octreotide, or somatostatin, which has shown to reduce the risk of mortality and bleeding in such patients. The patient should be immediately started on PPI therapy, because many of these patients have bleed from stomach or duodenal ulcers, and this can be prevented by PPI therapy. The patient should be immediately resuscitated so that his blood pressure and pulse and hemodynamics are maintained, and this requires quick care in an emergency setting and ICU setting for the patient to be stabilized. Patient might require IV fluids, patient might require blood products to maintain his blood pressure in such a situation. Once the patient's blood pressure is controlled, then the patient will require endoscopy treatment to take care of these bleeding varices or bleeding blood vessels, where they do a procedure like banding, where they put a band on the bleeding vessel and stops to bleed. In emergency situations, if endoscopy cannot take care of it, then balloon is inserted, or a stent is also inserted these days to take care of these severe bleeding episodes. Sometimes in emergency situation, patient might require a TIPS procedure also to take care of these bleeding varices. Also, like I said, upper GI bleeding is a life-threatening complication of cirrhosis and is one of the first markers of decompensated cirrhosis. So, if the patient is having upper GI bleed, then it is an indication that the patient might require liver transplant to have a better long-term prognosis and a better long-term survival. So if you think there was useful information in this video and you benefited from it, then please like and share this video, and also subscribe to this channel so that more and more people can benefit from it. Thank you.